Monday. There will be few places where I'm going to see
Yeah.
push a bit further, but at most I will just try to be as gentle as I can.
Yeah.
Okay.
I think when you come, I think I said on the phone. I always feel like, despite the fact that you say tomorrow, James, you might feel a bit, a bit stiff in places.
Mm-hmm.
Despite that, I do feel always better. Like after the session,
Yeah.
and the next day, might ache a bit, but yeah, I normally feel better the next 2 days, and then starts to and but then I like hit rock bottom. Let's say today's Tuesday, I might hit rock bottom on Saturday afternoon, and then I've got to tiptoe around and be so careful, and Saturday, Sunday I'll be really hard, and then I start to feel a bit better Monday,
Mm-hmm.
and then quite a bit better on Tuesday, and then you're here again. So it's almost like it's a cycle,
Okay.
and I don't think it's like, well, it always seems to be a cycle. I think you're helping me on Tuesday and Wednesday and Thursday, but I just wonder if sometimes my body, like, gets too relaxed. Like on the weekend, I maybe feel like, oh, I've had some good days.
Mm-hmm.
Maybe I'm like thinking, I've had a few good days. For example, I don't do this, but let's say I got to Saturday and thought, hey, I'm feeling a lot better. I'll jog up the stairs quickly, rather than being careful, you know what I mean? And then I thought, oh no, I'm really hurting now. So maybe that's just an example of how I'm maybe thinking I'm doing okay.
Okay.
And
Yeah.
I let my guard down too much.
Right.
And it's hard to know what too much is, because I don't want to walk around stiff and stressed out all the time, you know what I
Well,
mean?
I have to start combining the massage with some of the exercises.
Yeah, I need to rest, and in the morning it's like, what do I do first? Do I stretch the muscles out because they're tight and cramping up, or do I try to just get the weight off them, to let the muscles relax? So the first thing in the morning, my main focus is relaxing. I get out of bed and I feel like I'm on the verge of my back spasming. So I spend the first half an hour to an hour trying to just relax. Then I spend the next hour or two trying to stretch, but not too far, just a bit. And then hopefully by the time it gets to the afternoon, I've relaxed enough for the pain to come down, and I've stretched out to stop cramping up. Do you know what I mean? It's like I'm trying to uncramp and relax the muscles, but you can't do both at the same time. You've got to do one then the other. So it's like a constant. This is what I'm thinking all the time. I'm having to think, what should I do next? Should I stretch, or should I wait another half an hour before I stretch?
Maybe we should look at what kind of stretching we're doing when you're stiff.
Yeah. One of the things I do in the morning is I lift my foot up and rest it on the worktop in the kitchen. And that seems to be, the worktop then is taking some of the weight of the leg. So the back gets a rest. But I'm not stretching, I'm just lifting my leg's not straight, it's like bent a bit. And if I do a stretch on the floor, I won't do it too far, it's just a case of like spreading out the legs, like just easing into the day. I don't do anything too rigorous, because sometimes I used to stretch and set things off. There's no doubt about it. I used to stretch too far, too soon. I don't do that anymore. I'm always, really careful, and I'll do a small stretch, then a medium one, then a longer, later in the day. But in bed, I still can't seem to find. I know I changed the mattress. I can't remember if I changed it back. Can't remember anymore. I think I did. I'll have to double check where the new mattress is, if it's in which bedroom it's in. I think I changed the mattress back to the. Well, I didn't change it back. I think Simon Simon maybe changed the mattress back.
Okay.
Because the new one my mum likes was too soft for me. So I've gone back to the one I had, the old one. Yeah.
Okay.
So. I just need to be not sinking into the bed too much, at night, keeping the body straight.
Do you wake up during the night then?
No. when I wake up first thing in the morning, I'm not in pain,
Okay.
and then I like turn if my alarm's going off, I have to turn a bit in bed and reach and turn the alarm off, and that's when I might feel a little bit of a niggle, but nothing major,
Mm-hmm.
and then I get out of bed and I'm still okay. I sort of like I roll out of bed, and then I put my trainers on, and I'm sometimes thinking, "Ooh, this could be a good day," and then I like walk maybe towards the bedroom door, and it's like, oh, it's starting up now. The pain's like building and building and building until all of a sudden it's like, oh no, I've got to be so careful. And sometimes I have to then go to the carpet, go down, and I can't stand up any longer. Or I've got to try and stretch the leg or something just because the pain is like building up and building up
Okay.
too quickly to have a spasm. So I'll try and, if that doesn't happen, I'll just walk round and swing my arms a bit and just get going.
Question: when was the last time you had like the real bad spasm and your back set off?
I mean, I had a bit of a spasm on the day I was supposed, 2 days ago. The pain came, but it wasn't as intense.
Mm-hmm.
But the last time my back went into, like 2 days ago was the worst day I've had since the start of the year.
Okay.
Yeah. So that was 2 days ago, where I had to get onto the floor and really had to like hold onto the chair with my arms and just say, oh no, not now, not now, like, oh god, oh no. I was like really kind of fighting it. It was like 9.8, you know what I mean?
Mm-hmm.
If 10's a spasm, it was 9.8. It was really close, and it was just like electric shock in my back. It really felt like electricity. So
Okay.
that was just 2 days ago.
Did you get the results of your scan?
No, not yet. Still haven't managed. I've done my tax return.
Oh,
I've had a few things I've done, and they cancelled my appointments, the 2 appointments I had.
it takes so long to get an appointment and then they
I
cancel.
know. I had one last Friday and one this Friday and cancelled them both.
Yeah.
I've now had a message to say they want me to go next week to Middlesbrough. And it's like, it's really close to my GP appointment. So I'm going to phone up and see if I can move it to maybe at least the week after. So, because I won't be able to do it all at once,
Right.
And although most people would say, you can get a GP appointment another day, James, move the GP appointment. I can't. This lady that I see, I have to wait 12 weeks or 14, 12 to 14 weeks to see her.
Yeah.
I wouldn't get her again, and it's a double appointment. So I can't afford to miss that.
Yeah.
And to be honest, I get more out of seeing her than I do seeing the foot surgeon.
Yeah. Well.
So I'm going to try and move the foot surgeon's appointment, because the last thing I want is to attend that, but then be too ill to go to the GP appointment.
So which day they are putting you for appointment then?
I think it was Wednesday or Thursday for the appointment in Middlesbrough.
Okay. Next week.
I thought you said it was cancelled, James.
Yeah, they've given me another appointment now. So it got cancelled.
And is it still next week?
Next week, not it was supposed to be this Friday. So I think it's the following week, on like maybe Thursday the following week.
Right.
And but my GP appointment is on the Monday, and I've got pain management appointment I think on the Wednesday or something. So there's like 3 at the moment as it stands. I've got 3 appointments in 6 days.
Mm-hmm.
And I can't do 3 appointments in 6 days. So my thoughts is, I'd rather see the foot surgeon after the GP, because I want to talk to the GP about what the best thing is to do in the foot surgeon appointment. I want to get her advice of what should I do and say in the foot surgeon's appointment, because I'd like a diagnosis, and I want her to like look at what he's written already, and on the computer she'll be able to load up what letters she's had from him, and she'll be able to say, yeah, you're right, this is not a diagnosis, you deserve a diagnosis and I'll back you up for that. She might even send a message to him, you know what I mean, before I get to see him. She might send a message beforehand, like saying, please, when you see this patient, can you give him a diagnosis, because at the moment we haven't got one on file. Do you know what I mean? So I want to see her first.
And how about the trainers?
Oh, that's not yet. They've got to spend time making the insoles and the trainers. The next appointment won't be here with your trainers. It'll be just let's try them even though they're not finished. Let's try a fitting, trial fitting of what they've designed so far. So like there won't be any laces. You just slip your foot inside and make sure it's wide enough and things like that, So that, and they'll say we've made you some insoles, and they'll give me the insoles to take away, but I might say that they're not right. They might have to try again. So they might not be able to give me the insoles, or they might say try it and come back for your trainers, but also bring the insoles back and that sort of thing, So we'll try and change them if you need them changing. Or if they're completely wrong, I can just say these are dreadful, can you please try again? But I can tell immediately they're not right. So that is going to be maybe in about 5 to 6 weeks from now.
Oh, really?
It takes time, yeah.
Well, why take so long then?
Well, to make the trainer, that always takes a while to make the trainer, and they've probably got a backlog of work, I don't know. But the install shouldn't take long. The install, they could even do it on the day itself.
Yeah.
But they get somebody else to do the install. Like, it's not the lady that I saw. She sends the information away and somebody else makes the install and makes the trainer. And this is why it's really nothing like what we've talked about. It comes back and you think, have they even read the notes? They've just made what they think's best. Because sometimes when they see my foot's dimensions, they think nobody can have a foot this shape. So they end up like designing something else. Or they'll think, well, everybody needs a bit of a heel in their foot, footwear. So even though it says, please can you design it completely flat, the person making it knows better. So they'll make it so it has a 1 centimetre heel. They'll think it looks better. So then it's wrong, isn't it? Because it's not what I asked for. So that's going to be in about 5 to 6 weeks from now. I've actually got the appointment letter, but it's with a man, and I saw a woman, and she was good. So I've got to ring up and change that anyway because I want to see the same lady again.
Right.
So that needs rearranging slightly, but I'm hoping they can do it at a similar time, in 5 weeks, not more.
But that needs to be whole.
That'll be in Hull, yeah. So, so I've got these appointments, that I'm waiting for. The pain management one is with the actual doctor, not the physio. But I'm supposed to have a physio appointment with pain management.
Right.
But goodness knows when that's going to be. And I'm going to say to the doctor when I see the doctor, like, is it normal having to wait 6 weeks for a physiotherapy appointment? From one appointment to the next? 6 months is a long time. And I've seen different people as well, so there's no continuity at all. So I'm actually going to say, is it possible to just not have any physio anymore? Because I can get to see somebody else then. Whenever I'm seeing pain management physiotherapists, I can't see any other physiotherapists.
Oh, really?
It gets blocked. Yeah, you can't. They block it. Because I did see someone a while ago in the NHS, a physio, and he said, I can't see you anymore because I've seen now you're in pain management. So this is our last session. And I can't treat you for anything above your knee because you're in the pain management for your back. And so that means anything, one joint lower than your back and one joint higher, which basically one joint higher is right up to your head, and one joint lower than the back, it goes down to the knee, he said. So I can't treat you for anything above your knee because you're you can't be treated in the NHS for the same thing with two different things. Yeah.
Oh boy.
And I just said, well, I'm actually not getting any physio through pain management. I haven't had an appointment for 6 months, and we only discussed my mental well-being.
Mm-hmm.
And then 6 months before that, it was just, hello, what's your name? What problem do you, let me just take some of the details, what job do you do, how long have you had this for? I said that wasn't even a treatment, that was just a, hello, what's your name, where do you live? I said, so I've not even had anything yet, but you are down for physiotherapy through pain management, so I can't help you.
No, that's so ridiculous.
So he discharged me, and that must be a year ago now, and I've still, since then, not had any proper treatment for my back or feet or knees and hips or
Mm-hmm.
yeah. So I'm just going to say I don't want to be written off completely from pain management, but I don't really think the physiotherapy is going anywhere. It's advertised as physiotherapy, but we spent more time discussing nutrition than actual physiotherapy.
Mm-hmm.
And most of the time we discuss mental health and well-being. So really, I just want to have a good chat with the pain management doctor. The pain management doctor I'm going to see is a different one to the one I've seen before.
But still New York.
Still in York, yeah, but they actually are somebody who works privately. I've looked their name up. They do a private as well as NHS.
Okay.
Whereas the other one, I was told, only does NHS. So really, if I think this pain management doctor is really good, I could even book an appointment privately.
Mm-hmm.
And I don't mind. If they're really good, I would. It's a new thing that's opened in York, a pain management clinic in York. It's like a new thing that's just started last year. And this is one of 4 people who works in this pain management clinic. And they operate from, I think, Clifton Hospital, Clifton Park Hospital or something. I've been there loads of times in the past when I was younger. About my knees. When my knees were bad years ago, I paid to go there, basically, they operate from there privately, and then the NHS, they do it from your hospital itself. So this doctor I'm seeing, I think they're called Dr. Dan Depani. So I'm seeing Dan Depani in your hospital, but they do actually do private.
Right, okay.
Because Shane, he said he went to, I'm pretty sure it's at Clifton Park Hospital.
Where is that Clifton Park Hospital?
It's, if you,
It's not the one off Tadcaster Road.
if you're going away, Clifton Park Hospital, it's, is it called Clifton Road, I think? That you're going out of York, away from the, you know where like, Bootham, you go down Bootham Road,
Okay.
and then at the end of Bootham Road, the road eventually forks into 2.
Yes.
And one of them I think is called Clifton Road, and I think it's just down there.
Okay.
Or, I'm trying to think if I've got that right. I think it's down Bootham, but then, yeah, I'm pretty sure it is. And you turn left, and you have to go down a long lane to this building that's at the end of a long track, past a couple of fields on each side, and then it's just set back off the main road. Yeah, it is off Clifton Road, and it's there's a car park that goes all the way around the building, and then you drive back out along the big track again, back to the main road again. So it's set back off the main road. So probably some big old building, that's been converted into a hospital many years ago.
Alright, well, I
Yeah.
don't understand that.
It's like a private hospital really, but NHS does some appointments there,
Yeah.
and it's not very big, but that's Clifton Park. I think I've got it right. But there is a hospital where I've described, and I think that's the Clifton Park Hospital. So I think Shane said that's where he went, and he saw a doctor that I've seen before, a back surgeon, Mr. Roman. Well, he's a nice guy, but he's not a people person.
Oh,
He
really?
doesn't talk much, no. I think Shane said the appointment was really short, He didn't really explain things very well, but he did say he's going to do something, you know, so he was willing to give it a try. Because I think he was going to be given like a machine to use to see if it could help calm down his pain. And
Right.
like a TENS machine, but it's connected to your body.
Ah, yeah, you
Something
mentioned
like that.
something to me like that, yeah.
So it's like the new thing that they're using now, you know,
Mm-hmm.
and it's gradually spreading from hospital to hospital across the country. So for pain management. So yeah, but the doctor that Shane's seen, Dr. Rahman, I've actually tutored his son, Rohit Rahman.
Oh, really?
Yeah, and his youngest son, Varan Rahman, and the thing is, his wife was really, really pushy, really like demanding everything. Like, you will get my son a top grade, you know, like, you know, just like not can you, or we're hoping he said you will, you know. And then when he didn't do very well in his exams, she was like really shouting at me on the phone. I had to hold the phone away from my ear. This surgeon seemed nice, don't get me wrong, he was nice.
Yeah.
But his wife, oh my god,
This is the coffee, never worked with.
like a dragon. You know, yeah. And I've been to the house loads of times, and they've been here, you know.
Yeah.
So because this was back in the day when I tutored at people's houses,
Mm-hmm.
and yeah, I mean you remember them, don't you? This man's wife, I think now it was
Is
Her-
this,
her
what's
auntie
his name?
came here once and
Yeah.
she made a dinner for us. And she brought a dinner with her when she came. Like a dinner for me and my mum to eat. Some special curry that she'd made. And it was lovely, really nice. And she brought him for his lesson. And she sat in this room and waited for him. And then she drove him back home. They live in Strensall. And the surgeon, he's been to my house loads of times. And he sat in this room waiting for me to finish tutoring his son in the kitchen.
Okay.
So Mr. Rahman, you know, I've got his number on my phone still, you know, so I know him really well. He's a back surgeon, and I had an appointment with him once, like not formally but informally,
Mm-hmm.
and he just started with, I totally and utterly believe in avoiding operations and they are an absolute last resort. So he just, you know, was very much against an operation.
Mm-hmm.
Unless you're on your deathbed, you should try at all times to avoid an